in a country transitioning to an upper middle income country, I felt that in this day and age, chronic malnutrition should never be a problem. And the Philippines is not poor, right? But I didn't have a choice but to do the work, to do the research project. But as our health team dug into the data, one truth became impossible to ignore: that malnutrition in the Philippines is widespread. And it's heartbreaking and it's gut-wrenching. And that the Philippines is an epicenter of chronic malnutrition. As Dr. Randy mentioned a while ago, that even though we are an upper middle income country, our stunting rates are actually comparable with notoriously high stunting rates in Africa or in South Asia. So in our earlier works in 2018 or 2019, we called the malnutrition, chronic malnutrition, as a curse. And to me, it's indeed a curse because it steals our children's future, shrinking their growth, learning, and economic potential. And about 1 out of 4 children in the Philippines are affected by it. So if this is the case, what future are we building for our children? So this book is actually an evidence and a call to action. So we break the curse by making children a national priority and by acting with urgency, coordination, and accountability. So this book is a culmination of years of work by PIDS and UNICEF. At PIDS, in the last, I would say, 5 years, we've produced more than 15 discussion papers and policy notes on nutrition alone, many in partnership with UNICEF, ranging from policy analysis to econometric analysis and novel methods for us to understand how much are we spending for nutrition. And a lot of these were also published in peer-reviewed journals. So our findings have been presented in both houses, the Senate and the Congress, informed legislative deliberations, and contributed to concrete reforms, not only in early education, but health and nutrition. So I want to acknowledge our co-authors and partners from UNICEF, especially Alice for her patience, from PIDS, Lal Casas for all the heavy lifting in this book, colleagues across the Institute for all the hard work, and special thanks to Dr. Mian Silvestre, colleague, friend, and mentor, and to Ian Nuevo, to Alyssa, who are co-authors of this book. I'm also very grateful to former PIDS President Babes Orbeta for pushing us to write a book about nutrition, and to our, again, partners at UNICEF for their steadfast support. So you might wonder why we came up with a title, Raising the Bar. So raising a bar is a term because we want to stop setting for slow, sporadic, and uneven gains. Raising the bar means setting higher targets and forcing tougher accountability and investing in what works, not investing in politically convenient interventions. That's why it's raising the bar. And that means we need to invest in good nutrition in pregnancy, better and diverse diets in early childhood, safe water and sanitation, strong primary care, and effective social protection. And we have evidence to support that these interventions are the key, I would say, intervention that matters. Okay, so I'll just discuss the chapter 1. So basically, chapter 1 of the book asked a very simple question. What future are we building for Filipino children? So as we've mentioned a while ago, that the Philippines is in the cusp of an upper middle income country. $26 na lang tayo, we will become an upper middle income country. However, many children in the Philippines, or as I would say, many of our outcomes are still comparable to the poorest countries in the world. So in this chapter, to have a different, I would say, take on why are we having this problem, we try to dissect health outcomes in the context of a macro fiscal lens. If the economy is growing, why aren't our children nutrition or health outcomes keeping up? So this first chapter, shows how welfare has been left behind despite success in economic growth, and what must change to turn fiscal space into real gains for children. Okay, so in the first chapter, we discussed a lot about health outcomes. We dissected a lot the current state of health outcomes, especially for children in the Philippines. So the first question is, are Filipino children healthy? So a first lens to understanding the health and nutrition of our children is looking our infant mortality rates. Today, the Philippines stands at 21 deaths per 1,000 live births. That's actually better than the past decade. In other words, 97% of babies in the Philippines now reach their first birthday. But if you compare this to other countries, especially among upper middle income country, this is still very low, right? So infant mortality reflects the strength of our neonatal care, immunization, and overall quality of services. And it made worse by malnutrition, where wasted and stunted children are 12 times more likely to die. So the progress is real. The improvement in infant mortality rates in the Philippines is actually real, but not enough. So in the Philippines, infant mortality has fallen much more slowly than in our neighbors. No, you can see the red line. It's just it's not as fast as we want. So you can see Thailand, Malaysia, Vietnam, and even Cambodia dropping at a very fast rate. No? Because of this low decline in infant mortality, the Philippines missed, for example, the 2015 MDG targets. And in the paper, we've argued that without major reforms, we are risking, or we will miss the 2030 SDG as well, if we are just business as usual. And the message is clear that progress is real, but not enough, not at a pace our children deserve. Okay, so here's the uncomfortable truth. So the Philippines is, as I mentioned a while ago, on the verge of an upper middle income country. $26 na lang, then we'll become an upper middle income country. But many child health and nutrition outcomes still resemble those of the poorer countries in Africa and in South Asia. So on the left, you will see here that our stunting rate line inches down, while neighbors like Vietnam and Peru, or even China, for example, these are high-performing countries, you will see large decline in chronic malnutrition. On the right, basically, is the scatter plot showing that the GDP growth rate did not translate into faster nutrition gains for the country. So in the paper, we are arguing that growth alone won't fix the problem of child and nutrition health and nutrition challenges in the Philippines. So we have to raise the bar. So if you look at traditional economic books, economic growth is assumed to fix nutrition. That's the usual understanding of how economic growth affect nutrition, meaning higher incomes that will lead to better diets, then obviously it will result into less stunting. But the data says it may not be true. The Philippines has sustained GDP growth rate, yet stunting has fallen only slowly. So on the right, we've already shown this a while ago, that the country growth rate versus change in stunting. And what you can see here, that many countries reduced stunting faster than we did, with similar or even lower growth. So we begin to ask, why stunting is stubbornly high in the country despite the relatively high growth? So from macro fiscal perspective, it means that higher growth expand fiscal space, meaning that when your good GDP growth, when your economy increases, you will raise revenues and you will have affordable borrowing for health and nutrition, right? But growth improves nutrition only if resources are allocated and executed well towards cost-effective, evidence-based intervention, and these resources are distributed equitably. So in the first chapter, we tried to answer, why hasn't growth fixed malnutrition? And we argued for several reasons. Number one, higher revenues because of higher GDP don't automatically raise health and nutrition spending. In one of our studies, we look at LGU spending. And what we've seen is that LGU data is quite, or I would say LGU spending is quite inelastic, meaning a 1% rise in revenue lifts per capita health spending by only about 0.27% overall. And the source of the resources doesn't matter, may it be national, transfer, or grants, meaning that we argue, even if you increase your national transfers to local government, we will not be sure if that will translate to higher spending in nutrition or health. Second, and I think this was also discussed, I think in second or third chapter, is that we under-prioritize cost-effective programs. Majority of our resources are into school feedings, for example. So we are under-prioritizing cost-effective programs in the first 1,000 days, but not necessarily interventions that could reduce stunting. Third, growth is unequal. Gains concentrate among higher income groups, so poor households see little improvement in diets, care, and living condition. And lastly, the challenges of social determinants, such as overcrowding, poor wash, and unsafe environments continue to heighten stunting. So the takeaway of the first chapter is that growth creates fiscal space, and we've seen that over the last decade. But without prioritization towards cost-effective intervention, nutrition or chronic malnutrition will slowly, we will see a slow decline in chronic malnutrition rates. So if growth alone does not fix nutrition, the next question is, who is being left behind? And this was also discussed in the first chapter. The data points to deep inequalities in terms of chronic malnutrition and the issues on intergenerational cycle that starts very early. So here on the left, you can see stunting rises sharply for the poorest 40%, starting even at around 6 months and peaks at the first 1,000 days. So if you do not fix the first 1,000 days and we are only fixing it during first grade or second grade, we are missing a lot, right? So on the right, so we also try to understand the disparities in terms of chronic malnutrition. So on the right, the Philippines sits among those with the largest stunting gaps between the poorest and the richest. Yung naka-red, no? So if you look at the absolute difference between the poorest and the richest, we have the highest difference. And you don't see this disparity in terms of chronic malnutrition in our neighboring countries, right? Okay, so and I think this will be my last slide. So those inequalities don't fade with age, no? So we see the disparity starting at 6 months, but those inequalities don't fade with age. They compound and pass from one generation to the next. So we try to understand the weight of women in the Philippines. So on the left, you see the average weight of 5-year-old girls over time. For example, countries like Thailand, Vietnam, Indonesia have pulled ahead, while the Philippines lags near the bottom. So you can see the height of 5-year-old children in the Philippines are just the same for the same age cohort, right? So on the right, Filipino women of reproductive age, if you look at their height rises steadily with income, right? From 150 centimeter in the poorest group to 153 centimeters in the richest. So there is really disparity, and that persists during their adulthood, no? So why this is important in the discussion of intergenerational cycle of chronic malnutrition? Because shorter adult women are more likely to have low birth weight, stunted babies, and keeping the cycle alive. So breaking stunting means acting early and lifting the conditions of the poorest households so we can break the curse. So I think that's the end of my presentation. But again, this is just a snippet of the first chapter. So maraming salamat. So thank you.